First of all, a huge thank you to each and every one of you for coming out. I appreciate it. We appreciate you on a Monday evening for coming out, but this is such an important topic, as we all know. Allow me to introduce myself for those who may not know me. I am Henny on the Rocks, and please allow me to introduce the queen herself. Queen Cut. I am Keisha. And also, to my right is the right-hand man of Queen Cut. Wait, right-hand woman of Queen Cut. This is CSO. And what does that CSO stand for?
She's straightening out.
She's straightening out. She's straightening it out. Absolutely. We are for the culture. We're a video podcast or video show, social. Absolutely. So, for beginners, we all know why we are here. We're all here for the same reason. And I say the change is changing. Back in the day, I know when I was growing up, that was like a taboo. Like, you change. Oh, no, you don't talk about that. And I'm sure you hear that all the time as well. But we're here because it's changing, and we want this conversation to be loud, to be talked about more. Because speaking for myself, I'm struggling like a mofo with menopause right now. Yeah. There may be some of you here that is in premenopause or perimenopause. You're so lucky to be in perimenopause, but the struggle is real, and it just continues on and on and on. So I want us to be able to have the conversation, talk about what is going on, and just try to get in front of it if we can, and what we can do about it. So I am going to introduce the lady of the hour. The lady of the evening is Dr. Chandra Adams. Yeah, she is obviously an OBGYN, and she is an OB owner, or come on, owner, yes, owner of Full Circle Women's Care, which I am a patient of. I don't know if you knew that. I am a patient there. Y'all been all up in that, baby.
I appreciate you.
Yes, I am a patient there. You also work very closely with midwives who perform in and out of hospital births. You've even created a system for at your private practice. I mentioned Full Circle Women's Care that boasts a consistently low labor to cesarean conversion rate, which is awesome. You also serve as a obstetric, not today menopause, preceptor for family medicine residents in the Mayo Clinic College of Medicine and Science. Okay. She was also named Women's Advocate of the Year by the Jacksonville Chamber Professional Women's Council. Come on. Obviously, she is a sought-after speaker. She has been on various TV stations, including Channel 4, WJXT. You are an alum of Spelman College in Atlanta. Yes. And Meharry Medical College in Nashville, Tennessee. And she is also a board certified by the American Board of that word again, and say it one time.
Obstetricians?
Yes. Yes. I can't say the word.
OBGYNs.
Okay. Yeah. Thank you. So and this is not even a smidget of her resume, not even a smidget. Obviously, you can tell she is the real deal. So we are here to have just a private, intimate conversation. We are talking, whatever questions you may have. We're going to treat this as Vegas. What happens here stays here. We want you ladies to ask any questions that you may have. Personal, whatever it may be, because we're going to talk about that Sahara Desert down there, because it's dry. Okay? I was waiting for somebody. That thing dry, boo. Listen, it is dry. So we're going to talk about all that, and we want you to ask those questions if you feel the need. So I'm just going to jump right in. Okay. In the United States, allegedly, according to research, there is 1.3 million women that enter menopause every year, and the average age is about 51. So a woman will spend almost half of her life going through menopause.
You are correct. You are correct.
That is very, when you say it that way, that is very scary.
With our lifespans getting longer, we're spending more time in menopause. So just kind of going back to definitions of menopause, because everyone says, am I in menopause? Am I done with menopause? You don't get done with menopause.
Ever?
Right. No.
So this is it till I go to
see St. Peter, yes. This is
wow.
it. So
that's sad.
No,
I don't think I realized that.
It's beautiful. No, so what menopause really is.
Okay.
So menopause is one day. It's an anniversary. It is the day that is 1 year from the last day you had a period. That's it. That's menopause.
Oh.
One day. Everything before that day is premenopause. Everything after that day is postmenopause.
Wait, say that again. Yeah, say that again.
So we're going through menopause, or you're in postmenopause.
This is postmenopause. Right, this is postmenopause. But all the symptoms that you have, the hot flashes, the night sweats, the Sahara, yes, the brain fog, all of that is perimenopause. That's perimenopause. Perimenopause can start as early as 40, and that's normal. As we said, the average age is 51 for that anniversary, for that day. But it can last, perimenopause can last 7 to 10 years. All of these symptoms that we're going through, I know, or longer, depending on your genetics. So yes, I started with the hot flashes and the night sweats a while back, and I was like, oh, okay, all right, cool, I'm getting into it. And then I asked my mom, I said, Mom, how old were you when your cycle stopped? And she said 56.
56?
It's the same thing I said. 56. So that means these symptoms that I'm having could continue for several more years, and could continue for years after my anniversary, my menopause day.
Wait, so, what? I have never heard this.
Yeah.
So menopause is one day.
One day.
OMG.
So that's why you say it's really not a bad thing. It's
Because
you said it's a celebration.
It's a celebration.
I can't celebrate, y'all. I'm
The
sorry.
only way to
What's the
avoid
alternative?
menopause is to die.
Oh,
It's to die. But you know, our lifespans are longer now. That's wonderful. That's a reason to celebrate. So really now it's more about figuring out how to survive perimenopause and thrive in postmenopause.
Wow. I like it. I like it. So again, I'm a research lady.
Go for it.
So, according to research, a black woman will spend up to 10 years suffering with menopause symptoms, while a Caucasian lady will spend about 6 years suffering.
You are correct.
Why?
Okay. Why? Just why?
Just why?
Just why? That's a great question. So a lot of it has to do with comorbidities too.
Who?
Comorbidities, other health factors.
Oh, okay.
Other health factors.
Oh.
Yes.
Stepping
yes.
on my toes now.
Listen,
Okay.
listen, I'm just here for information.
I know that. Yes.
But some of it is foods that we choose that can make menopause symptoms worse. No, I'm not looking at you. I'm not. I'm not making eye contact at all. I'm looking all around the room. It could be anyone. We all make interesting choices.
We do.
With our foods too. Exercise too. So menopausal symptoms improve with more cardiovascular exercise too. And those same things that you were researching, I'm sure probably also said that we have some disparities in terms of
community.
Absolutely. So and that's some of it. And some of it too is we just don't talk about it, or people just don't talk to us, and so we will suffer longer with the condition because we never really tried to have a conversation about this. Like you said, it was taboo. It was you just go in the room and sweat until you're done sweating, and then you can come out and finish cooking for everybody else. And so we end up taking care of everybody else, neglecting us, not having these kind of girlfriend conversations, and not getting to the real answers that will shorten our suffering.
Have you noticed a spike in menopause patients at your facility?
Probably so, just because the practice is kind of aging with me. Like I started Full Circle 10 years ago, and I was having babies, my patients were having babies, we were all having a good time.
Yes.
And don't be fooled, I'm an old mom though.
Really?
Yes.
Okay, come on.
Yes, I'll be 50 next
Oh,
year.
you're just a baby.
But listen,
Don't be a
I have
10-year-old.
babies. Right.
That's the difference.
Right, the difference is I'm 50 with an 8-year-old.
Oh, 8-year-old.
Right, yes. So you know, and so we all have the babies together and everything, and now we're all getting older together. So they're coming back like, hey, you know, I don't really want to talk about prenatal care anymore, but can you do something about these hot flashes? And I'm angry all the time. My family's on my nerves. My husband told me I need to come talk to you.
See, we were talking about that, T. Yeah, the partners. Yeah.
Yep.
But that is definitely something to consider when it comes to your partner, the person you live with, because they take the brunt of this. They're about to get it.
Yes, they are.
I was really surprised when I read that there are over 100 symptoms to menopause. Did y'all know that?
No.
I knew it was a lot. I didn't know about
It's over 100. Yeah. What do you say are some? We know the common ones: the night sweats, the hot flashes, and all that. What are some of the uncommon symptoms, please?
Gosh, and maybe I'm a little biased and skewed because all day long I'm talking about all the symptoms. But the things people don't really discuss quite as much are the skin changes, the hair changes.
We just talked about that.
Okay.
My nose has been peeling, and I was like, I don't know. All of a sudden, it just came out of nowhere. It's just peeling, and it's not like I've been exposed in the sun or anything. Just my nose and stuff, and that's what Annie said.
Yep. When I first went to menopause, it was so bad that all the melanin around my mouth, of all things, as much as I talk, the melanin around my mouth was nothing but white. Y'all wouldn't have even noticed me. It took all my melanin. And I went to dermatologists and all. Oh, you'll never get the melanin back. You're gonna have to live with it. Devil is a lie. Because baby, look at me now. Okay. But anyway. Yes.
I had a lot. I feel like stuff was crawling on
Me
me.
too. I have that now.
Yeah, especially on your nose.
Yes,
and you're doing like
nose.
this
The
a lot.
It does. And then I looked it up and it said menopause.
Yeah.
I was like, what does this show have to do with menopause?
It's such a chameleon. It's so hard to treat because people come in and so many things could be menopause, but could be something else. So, once that's the other concern is you don't want to just spend all your time treating this one thing that you're sure that it is and ignore other things. Brain fog. I was on another panel recently. We were talking about the brain fog. How you walk into a room because you need something, and you just walk back out the room because you don't want to just stand in there, and so then you walk back in the room because you remembered what it was, but it's still gone.
Yes.
And so the question though is that perimenopause or is that early onset dementia?
Right.
How do you know the difference?
Right.
How do you know the difference though? You know what I'm saying? So a lot of things are perimenopause, but a lot of things
Yeah,
are
I
not.
do know the difference.
Men do that too. Like they forget. Like, well, what was I coming in here for? They do the same.
I call that menopause.
I know that. Yes, menopause. Yes. You know what's one of the symptoms that scares me the most is the heart palpitations. I've been it's so bad, baby. My heart be wanting to crawl up out my mouth and just walk on. Yeah, your heart just be racing for no reason.
But how do we know that's and not? Right.
Exactly.
Yeah.
Exactly. So, part of it is just knowing, so what happens at menopause? Like, so what happens on a day? So what are your brain and your ovarian connection? Like what happens then? So prior to that point, your brain is telling your ovaries every month, make an egg. And then your brain says, release an egg. And the older that we get, the closer we get to menopause, that brain is yelling louder and louder at the ovaries. And we can see this in your blood work. There's a hormone called FSH, follicle stimulating hormone. And we put no effort into naming it. Follicle stimulating hormone is the hormone that stimulates your follicles. So your brain releases it to tell your body to make an egg. As we get closer to menopause, your brain has to talk louder, so to speak, and your FSH goes up and up and up. So people pre-menopause, when they're still ovulating regularly, can get pregnant. Their FSH is usually under 10. That's when my patients come to me and they say, I want to have a baby. Let's check your FSH and see where we are in the process. Numbers between 10 and 40 tell me we're approaching menopause. We have some diminished reserve in these ovaries. They're not going to make as many eggs as the brain keeps telling it to. Numbers over 40 in combination with no periods are pretty consistent with menopause. So FSH is one blood test that we can use to see periods stop, but is it menopause? I'm having these symptoms, is it perimenopause?
So FSH doesn't determine that?
Not by itself, because I always I will draw blood work, but I treat the person, not the paper. So if you have an FSH that's over 40, but you're still, okay.
You got a line. It's all right, sis. Keep going.
That was one.
Yes, you got a line one.
So, is people will have an FSH that is over 40, but if you're still having a cycle every 3 months, every 6 months, you haven't hit your anniversary yet. So that's not menopause. The FSH is supportive of the diagnosis, but we have to have the anniversary to call it menopause. Yeah.
So what do? You just go say, hey, I need FSH testing?
Great question, because the question is really, what does FSH produce then? Because it says to your ovaries, make the egg. Along with that, though, is your ovaries making estrogen. And estrogen is really the key to all of these symptoms that we have. We have estrogen receptors on almost every organ in our body. We think about the estrogen receptors in the uterus and on the ovaries, but you have estrogen receptors in your brain. You have estrogen receptors on your skin, on our vaginal tissue.
Oh, wow.
Come on, say hello. And in this area of the brain called the hypothalamus, which is what regulates our temperature. Yes. And so if we stop making estrogen, we stop connecting with all of those different organs. Estrogen was regulating all of these things for us, keeping our skin elastic.
So when that estrogen starts going down, we in trouble.
That's
where scarlet comes from.
So in that case, I know we hear about HRT causing cancer and things, because I suffered without it, but then I decided I wanted to use it, right? So my doctor prescribed me a compound, and I put it right here on my diet. It's been amazing.
Really?
Yes. Yeah.
So what did it do?
Yes, all that.
So I do it, but it's a low dose. He started on a low dose, and I rub it to cream, and I rub it on my thigh. It has calmed my night sweats a lot. All the perimenopausal symptoms I've been having, I don't have a lot. But then I don't just do that by myself. I've been exercising, and I noticed I charted foods that would make me have my symptoms for like spicy foods and wine, like alcohol, wine like that, would cause
Chocolate.
it. So different things would cause it, but it's been amazing.
Can we talk about that?
Absolutely. So hormone replacement therapy, because you were all asking, well, what is it? We just talked about what the ovaries produce. So the ovaries produce estrogen and progesterone. But when the ovaries stop working, your estrogen and progesterone go away, and all those feelings that come with all those hormones being gone, now we feel them. If we put the hormones back, then we get rid of all those feelings that come from the hormones being gone. But that comes with a risk, because we're designed a certain way. We are designed to be exposed to hormones for a certain period of time in our lives, not continuously forever and ever and ever. Because the longer we are exposed to those hormones, the more we do increase some of our risks, not just for cancers, but for cardiovascular disorders. So many years ago, when people went into menopause, go to the doctor and they say, I'm just gonna put you on hormones, and it was wonderful. And then they did that study, the Women's Health Initiative study. Yes. And there hasn't been a study like that again. There probably won't be. Well, I mean, they had to stop it. They had to stop it because they were finding out that the risks were so great that it wasn't ethical to continue just giving it to people to see what happened. Now, in the right population, with the right patient who is exercising, doing other things to modify their risk factors, HRT can be a good bridge into when your symptoms stop. Because eventually the symptoms will stop on their own. Eventually. It just doesn't feel like it, because 7 to 10 years is a long time to suffer with these symptoms. But sometimes you can use the HRT just as a bridge. And what your doctor did is exactly right. When we talk about start low, go slow, come off of it as soon as possible.
But I have to go every 3 months to do blood work and everything like that to make sure. But he's not keeping me on it long. He just kind of wants to see could it help.
So what are the side effects? What are the downside of that miracle cream? I'm telling you. Rub your thigh on my thigh. Let's both thighs. What?
Let's do that.
I'll say this though, and we probably are gonna get into this because this is one of the main things that we as women suffer with is low libido, our sex drive, right? And if you're married, we all know. I'm sure we get into that. My husband thought I just wasn't even attracted to him anymore.
Yeah.
I just didn't have the urge.
Yeah.
I just
Right.
that was the last thing was
No,
on my
what
mind.
causes that?
I will say the cream has helped that. Yeah, the cream has helped my sex drive.
Okay, great. Very good.
So estrogen is related to that too. Yes.
I was gonna say, so if she takes that, so if I'm a breast cancer survivor, so, and I know, so should you, I've been told that taking hormone stuff is not a good idea. Which I don't think, but I had heard that even before.
That's why
I
they were cancer.
Yeah.
Well, so we're starting to reanalyze the data in light of women living longer and suffering more, because the numbers that Women's Health Initiative really came up with, you know, they were talking about so many women per 100,000 per year, and we're talking single digits for some of these risk factors, double digits for some of these risk factors, but per 100,000 per year. So the longer you stay on it, yes, you may get into higher double digits, but if you stay on it for a short period of time, come off of it, then your risk actually goes back to what it was when you weren't on it before. So as soon as you discontinue it, your risk goes back to whatever your age-related and family-related risk was.
So wait, if you discontinue it, do the symptoms come back?
They might. They might.
Please.
You just don't know. You just don't know.
It's a chance you
So it's
just.
like a Band-Aid.
But you can come off of it for a while and the
And go
symptoms come
back.
back. Just go back on it. Like go on. So I do this thing, you know, when
As
we do
Yeah.
year to year. I say come off of it for a month. If the symptoms come back, I'll re-prescribe, and I'll have patients write back and say, hey, I came off of it and I feel fine.
But I don't do it. What I did was, because I just don't like taking medicine, and I did a lot of research before I decided to do it. I'll take it, I'll rub it, and then in maybe a month I won't use it.
Oh,
And
really?
then I'll come back.
So how do you know when you should use it?
When my symptoms start getting really bad.
Oh, okay, when that cream stuff
Sometimes,
in.
yeah.
Gotcha.
When sometimes when the hot flashes come, it's manageable. But when it starts coming back to back, and then I just start feeling horrible, because fatigue was one of my biggest things too. I was just tired, and I'm like, I don't know. I'm taking vitamins and everything, but I was just tired. I knew it wasn't nothing else because I constantly get blood work. I constantly get my physical, so I knew it was part of the menopause. When I started using the cream, I get energy. And things
That's
of
what
that
I'm missing.
nature.
That's what I need.
So,
Energy.
That's the best way really to do it, is to use, because the replacement is for your symptoms.
Right.
It's for comfort. It's not medically dangerous to
Right.
experience these symptoms.
Oh, it's not
just-
medically dangerous.
It's not to experience these symptoms.
Oh,
It's
okay,
not
okay,
medically
okay.
dangerous to be in perimenopause. It is for your comfort. So you should use the medication to make yourself more comfortable. You're not curing
Right.
yourself of anything. You're just making
Yeah.
yourself more comfortable.
I always go back to the conversation Oprah had with Dr. Sal. She did a whole panel with celebrities, which we are too.
I saw
And she said that getting on hormone replacement saved her life. Oprah said this. It saved her life. But then on the flip side of that, I hear, you know, the streets is always talking about. The streets are always talking.
Dr. Google.
What? Yes. And it talks about the side effects of hormone replacement. And also I hear that a few women, when they take it, they got breast cancer. So yeah. So that's why I've been afraid. So I've been thugging it out. But I'm sick of it. I'm sick of it. I'm sick of all of it. So I would love to release, but at the same time, with all my ailments, I can't risk. I just can't risk getting, you know, breast cancer. So I'm on the fence about the hormone replacement. But is it true that women can get cancer?
Yes. Yes.
Yeah.
Yes.
Is there a factor?
Yes.
Oh, I'm sorry.
Well, because, okay, I get shots, like, really they're not that bad. It's like once every other month, because some people have to go monthly. And I get a B12 shot, and that's only because I'm fatigued and this, that, and the other. I, to be honest, didn't even know I was dealing with any type of menopause, anything like that. I would have the mood swings. That's the biggest part for me. It's like I go from 0 to 100 real quick, and then be crying. And
I did that yesterday.
I just dropped ice on the floor, and then it's like, I remember one instance, I was breaking ice, and I just got it all over the floor, and I just started bawling.
Oh, wow.
And my husband came in, and he was like, okay, he looked at me. He said, you can just go lay down. He's like, you can go lay down. And the kids were like, Mama's like, Nick, leave it alone. Leave it alone. But he was so good at that. And to be honest, he was the first to tell me that I was going to, because I didn't realize. I always think I'm always cold. I'm always cold. And this was in the wintertime. I had on my little silk satin, whatever the case is, and I was nice and cozy. All of a sudden, I was taking everything off. And he was like, you okay? I'm like, no, he said, because it is not hot in here. He said, I really think you having one of them things. I said, one of them things. So I understand, because I'll tell you the honest truth, I can count the times that I have had a hot flash. So I'm always, because I'm anemic, I'm mostly cold. So when that started happening, I'm telling you, I was at one of the amusement parks in Orlando. And it got so bad, it was already hot, but it got to the point where I bought one of them waters, you know how they sell them like $4 on ice. I got it and I poured it straight down the back of my brain.
Oh my God.
They was like, you okay? I'm like, man, I've never come to an amusement park in the daytime anymore, but it wasn't that, it was just me.
Yeah, but you didn't know back then.
No, this was recently. That's why I'm
Oh, my bad.
That's what I'm trying to tell you. This was
A year
in the last
ago.
couple, like a year or two ago. But most of my friends, some of them have already experienced menopause in their late 40s. So I was late, and I don't know if it relates to when you were young and you were late to get everything else. It all fell late for me.
But does it have anything to do with your mom?
It does.
Like, yeah, okay. This is my sister. So I asked my mom, because I was told.
There you go with that nose.
To just, yeah.
Somebody knows. Yes.
But I asked my mom how, but she had a hysterectomy, a full one, back in the day. So she said that she don't remember having hot flashes. She just remembered the attitude. So so I got that from her, just get mad real fast over it's not small to me. It's not small to me when it's going on.
Yeah.
But when I think back, I'm like, you need to take all that.
And I'm the jokester. I'll laugh right on through it. Like, it ain't that serious. It's just so funny.
It ain't funny to me right then.
Right.
But then when I think back, I'm like, that really was, it just wasn't that serious. So why do you have such an attitude?
So it's the hormone fluctuations. So when your cycles start, like at puberty, your hormones are going like this. And then over time, they kind of even out and your cycles get regular for some years, and they stay regular, and then we get to perimenopause and it starts going like this. So I tell people when perimenopausal women are just teenagers with better frontal lobes. We just we want to slam doors and scream and throw tantrums and all that other stuff, cry all the time. But we know I'm at work and I gotta keep my job.
You got allergies. Don't ever admit it. You got allergies.
Right.
Yes.
Right. So we have better social skills and ability, but really it's the same process that's affecting us. And and like you said, it does depend too on genetics, what age all of these things happen. So my mom had me when she was 37. So I was 13 when she was 50. So puberty and menopause were in the house at the same time.
Oh, wow.
So all of this with the hormones, my dad just hid in his room for 2 years. Yes. Because it was the same thing from both ends. It was these two females in the house being affected by these fluctuating hormones.
Yes. So, when you mentioned about
You let me go home.
oh my goodness. So if you started in and this is just in my brain. This is just me trying to come to grips with when is this crap gonna go away. So if I started my cycle, if I started my period at 13, what you trying to say?
They was young. I was older. I was one of the late ones.
I was 15.
I was late.
Does that mean that menopause is gonna be over faster?
Wish
The
I-
symptoms?
It should be.
I wish I could tell.
Oh, God.
Yes, but I can't.
Wow.
It is different for everybody. It is different for everyone. We do see a lot of times that, so you know, also remember this is all related to how many eggs you have. So we're all born with the number of eggs we're going to have for our whole life. That's it.
I didn't know that.
Yeah.
So how do you know how many you have?
Where they at?
You know?
Yeah.
Where
This
Goodness.
is where it's staying at.
So we're born with like 100,000 eggs. And we slowly diminish our supply until we hit puberty. So puberty is when every month we get rid of at least one egg, but we may lose a couple of follicles.
So one egg?
One, unless you have twins, you might get rid of two.
So we still have eggs even after?
So no, when you run out of eggs, it's your anniversary.
Oh.
Wow.
Wow.
That makes sense.
So if I don't have any kids, can I get out of menopause early?
Wow.
I'm trying to find
Menopause.
going through it.
That's a good out, like you said.
It will be.
But will the shot tell her the B12?
So the B12 will probably help with energy. So that's actually a really good segue. So we talk about hormone replacement therapy specifically for symptoms that have to do with decreased estrogen. But if you're just treating symptoms, there are a bunch of different things that you can do specifically for that symptom. So if your symptom is just low energy,
No, that ain't the only one.
if someone else's symptom is just low energy, then B12 would be enough for you. You don't need hormones. You know, if we can treat what you're having without giving you systemic hormones, we should treat what you're having without giving you systemic hormones because it's not worth the risk of cancers.
But sometimes I won't even need it though. Sometimes my symptoms are okay. And then sometimes, like, I have a cycle come. I've been in perimenopause for 7 years.
Oh, wow.
So my cycle, I thought I was getting into menopause, but you know you have to have one full year.
Yeah.
And my cycle said, oh, no, not ready yet.
Sorry.
Right, hey, that part, yes. It was the 10th month, I was excited. But just recently, I had a cycle because I keep track. 2 weeks later, another full cycle.
Oh, wow.
So
And it caught me off guard. Like, like I had one cycle, and then 2 weeks later, a full cycle again.
That means it's great in?
Now do the fibroids play a part in that?
So the fibroids play a part in how heavy the bleeding is, not how frequent the bleeding is.
So that's the weakest time.
So I wish I could tell you that.
But
I
that's
wish that was the
what
good news I
for.
have for you today. But there are two patterns of perimenopause bleeding.
Because I thought that would have
There's no
messed
more
up too.
eggs, these
Girl.
eggs.
So wait a minute, what?
Mean your hormone cycle. We don't have it.
Okay.
But you still have all the symptoms. I'm still. So
So perimenopause can overlap with pre and post. So perimenopause is just
I had a cycle as soon as I did chemotherapy.
Really?
I
But-
did that. My cycle pretty much went. Well, they shut my ovaries down for a minute because I was spotting and just all over the place. So,
Right.
but it just never came back.
Mhm.
And it's
Thank you.
2 years, girl. But I'm still having hot flashes and all the other stuff. I mean, stuff like that.
So that's still peri. That's still peri. Peri is before that anniversary and after that anniversary.
Oh, okay. So
Yeah.
period is just
Peri is all around.
throughout.
Okay.
Okay.
I need his social security number to put him on my taxes.
Yeah, because I thought after menopause all that stopped. That's what I thought.
And that's what people are saying. I'm not done with menopause yet. When do I get through with
Yeah,
menopause?
yeah,
That-
yeah.
that day you finish menopause that day. Now it's post menopause. You don't even think
Oh,
it's
so
period.
that's enough.
So can we revisit the conversation of the symptoms that's not talked about enough or the most? Because like I said, we know about the regulars and all that stuff, but we may be experiencing some, speaking for myself, I think at this point, I think I'm just about to die because it seems like every day I wake up and it's a new ailment. And then I realize, oh, maybe this is menopause. So can you continue to talk about some of the symptoms that's not so common?
Yeah.
So joint pain is a big one.
just-
And especially she's grabbing me.
Yes.
Yes.
Definitely money.
Acne. Adult acne.
Oh,
I've
really?
never had
Oh.
acne she'll tell you, I've never had acne as a teenager ever. And every now and then I'll get like a couple in the forehead, some. I don't know. First I thought it was the makeup, and then I'll go sometimes with no makeup. And it's just that I go to
So
the
that's a
dermatologist,
symptom?
they're like, it's stress.
Wow.
They call it stress. But I've never had a problem with acne.
So what's some of the other ones?
So let's see, we said the joint pain, the menopausal middle. Everybody
Yes.
talks about that.
Yes.
Now that's
You know what?
Oh, I'm blaming it on menopause.
Well, they're excited, them getting it.
It's the specific, right, it's the specific distribution of weight, and it's visceral fat. It's not that fat that's right under our skin, it's fat underneath, like inside.
Wow.
And that is actually our higher risk for cardiovascular
Oh,
problems.
gosh,
Yes,
really?
it is.
See, that's why life coach should be free. You should be able to use your insurance card.
So how do you deal with
Yeah.
So those are dietary changes. They are, and they're strict, and they are tough.
Oh, wow.
They are tough, but they work. But they work. So things that dairy keeps weight on you like nothing else.
Really?
Really?
What about cold?
Dairy?
Probiotics are wonderful. They're wonderful. So gut health. Yes.
I
Someone
started
was just
probiotics.
yes. Someone was just saying the intestinal stuff. So constipation or sensitivities to certain foods, because again, estrogen receptors on our bowels. And estrogen was always playing a factor.
They ain't on estrogen. I can't stand her.
GERD, almost like GERD.
Exactly.
Wow.
Exactly. I know.
I'm telling you, we just
Okay, so I have a question. Well-
fair exchange?
It's not a fair exchange. No.
I mean, because, Eve and, Adam and Eve, I just don't feel like it was a fair exchange.
The men don't suffer.
No, if you have a choice, definitely in your next life, come back as a man.
the ear itching. That's really big. Nobody else-
Yeah, I have
Yeah.
shortage and my
My
back.
ear itch.
My
My
back.
back and my
One
shoulder.
spot.
It's the back thing you menopause?
So if
Oh my God, I thought I had rabies or something like that. Listen.
Back scratches all over.
I do too.
Oh my gosh. Today on the elevator at work, if they had cameras in there, they would be laughing. Oh my God. Yes, back yonder. Okay, it's good to know, because I'm thinking, I'm just
Why
going
is
to
this shirt so cute? I just noticed the
Oh,
lips.
yes.
Okay, I have a question. I don't know if it's menopause related or what, but I just read this like this week and it blew my mind. So I think it's called the labia, like the hot dog bun around the what?
the labia.
The happy smile. The what
Yes,
now?
the labia.
Labia. So they say as you get older, it shrinks.
Shrinks.
What are we talking about?
Your pelvic bone?
No, your hot dog buns.
The lips around you.
Right. Happy smile. Right. It's me or whatever.
Yep.
So somebody put that on threads, and so the lady said, I just reach my hand in my pajamas, and it sure is. And yes, I wash my hands a little bit. I'm like, wow, so it's shrinking myself. It's not that.
Right.
So where you can get bacteria infections more.
Wait a minute, what about bacterial infections? What?
Yes.
I'm saying some research.
Since we're talking about it,
I
what do we mean shrink?
mean, I'm trying
this long aren't that long.
They pulled out.
Oh, okay.
Yeah.
Thank you.
Wow. Thank you for
I
that.
just found that out. Like this.
Is there anything we can do about that?
This is
Some of you use it for money.
So,
think it was a bad thing. I don't know.
So it doesn't even do anything as far as.
Right.
It's a shield, it's like a protective shield.
Right.
yeah, so you were just saying if the skin is thinner, you're more susceptible to bacterial infections. Like we all have our normal flora that's down there, but it's supposed to it's self cleaning up and it's supposed to continue to wash out. If you lose your discharge, you lose your moisture, you lose your ability to clean. And then those thin tissues are very, we call it friable, like they can tear very easily and you can get bacterial infections vaginally because of that.
So what is your thoughts on dishing?
No.
Oh, I haven't heard that.
I know everybody says no. A little good.
I think she just covered that when she said it's a self-cleansing.
Right. That's what made me ask. That's exactly what made me ask. She said clean it up.
Wash it. Don't put anything in it that ain't supposed to be.
That's right.
But they did do it back then because.
I still do.
Yeah. You do?
That's the beginning.
I don't feel comfortable not doing it.
You do it.
But I really used to when I used to have a period. I don't
How often do you do it?
Oh, probably every few months.
Your period time is the cleaning time, right?
So really, constantly,
Yeah,
discharge, vaginal discharge is
Yeah.
It's a good thing.
Right, it is. Some people, and that's another point that we don't really talk about too among the younger girls too, because they come in like, I have this discharge, and I'm like, wonderful, you have a great day. We'll
Yeah.
see
Oh,
you
wow.
next year. And you're supposed to
So
have
discharge,
I mean, but it
no,
Don't
that-
be none bad.
the color do that is
Right.
right.
But the color, right, it's not supposed to stink. Everybody has a distinct odor, but it's not supposed to stink. It shouldn't smell fishy.
Right.
It shouldn't smell like you're baking bread or anything like that. But it's not supposed to itch and it's not supposed to stink. But white discharge is normal, and sometimes clear discharge is normal, just depending on what's going on in your cycle during the time. Now after menopause, some of the glands that are down there that typically will produce more moisture for lubrication for intercourse also dry up because estrogen was controlling those.
Could you speak on pH balance? So everybody talks about the pH
Yeah.
balance. Now, what is that?
Yeah, good question.
So the environment of the vagina is supposed to be acidic. It should be acidic. And again, estrogen helps to maintain that with our good bacteria. So the good bacteria, we were talking about probiotics before, some of you are taking some things that have lactobacillus and other acidic type bacteria in it. And those acidic bacteria help to maintain your normal pH and your normal acidic pH. Now, there are some things that are routinely introduced vaginally that are basic. So blood is basic. So every time, so there are some people that say, well, every time I get my period, I get BV, bacterial vaginosis. I get this fishy odor after I have my period. That's because probably right before the period, your pH was just a little bit off and that basic blood just kind of knocked you over the edge. Or after sex, semen is basic. So for women who have kind of a pH that's off because their estrogen is off and it's decreased the cleansing, they may start to get more BV, more that fishy odor, and BV is so difficult. It's so difficult to get rid of. When people, the chronic bacterial vaginosis, if you have some underlying issue that is contributing to it, it's just really hard to get rid of. And women will come in every 2 months. It's back again. It's back again. It's back again. Multiple courses of antibiotics. You take the antibiotic, it gets you a yeast infection. You take the yeast infection, it gets you back to BV. You get everything straight, then you go and have sex, and now you're back to BV again. And then so it is an unfortunate cycle.
But is there a way to get rid of it?
So it is usually consistent use of something that maintains your acidic environment, whether it's probiotics, whether it's boric acid, whether
Boric acid? How great.
there's a compounded formulation for boric acid that restores vaginal pH. It actually treats bacterial vaginosis.
I'm getting
I
flashed
know,
into my
boric
direct.
acid is the stuff you put for roast.
Don't do that.
being in there.
Really?
Now with boric acid.
Right.
Oh.
Okay, no,
Wow.
I need to sense
No wonder he's so sick.
No what's going on right
So
there.
what are some of the natural remedies that we can do that can combat the perimenopausal symptoms?
Okay, so we'll start with hot flashes. So if we're looking for herbal supplements, so herbal supplements like valerian root, black cohosh, those
Black
are
cohosh works.
yes, those are wonderful for the hot flashes. What we have to be careful of are the soy products. So you'll see things over the counter that say they have plant-based soy, and we're like, oh, plant-based, that's
Yeah,
wonderful.
yeah.
That's
Good
okay.
word now, yeah.
Uh-huh. Your body treats it like a natural estrogen, which means it can also increase your cancer risk if you overload on soy. Plant-based soy. So the valerian root, the black cohosh, you can use those in 6-month increments at a time. Take a little break from it and then go back to it.
Okay, I've been off of mine for about 2 years, so I can go back.
Oh, absolutely.
Okay,
Yes.
because it works.
Yes.
That black, that black
Where do you even buy something like that?
That's why you come off of it.
Like a health store?
That's why you come off of it
Oh,
for a while.
okay.
Yes, you come off of it. It's like a detox. You know,
Oh,
just
Oh, I
let
see,
your body
I
right.
see.
Yeah.
Are they all created equal? The black
No.
cohosh? Oh.
No, no, but mostly just because of brand names. Mostly because of brand names, because they're not FDA regulated.
Oh.
So what they say is in the package doesn't have to be in the package because they put that little disclaimer.
Oh,
This is
wow,
not intended to
yeah.
diagnose or treat any illness.
Is it a pill? Is it a drink? Is it a mix? What is
It
it?
comes in different forms. There are powders that you can dissolve into water. There are pills that you can take, gummies that you can chew to.
Do you favor one over the other?
I like the pills, and so I find my brands that I really like. I like I'm not gonna say any brands on the air, but I have my brands. I have my brands I like. You come see me, and I'll tell you my brands I like.
Yes.
But then there's also for mood, for depressive symptoms and mood swings, ashwagandha is really good also. Ashwagandha is good for anxiety too.
Ashwagandha.
Ashwagandha, I heard of that.
Doesn't sound like it other curious.
And St. John's wort. St. John's wort is also good for depressed mood because when we're perimenopausal, you feel like it's PMS all the time, you know. And St. John's wort is excellent for that. There's also 5-HT, which is the precursor
Oh, I've
to
heard. I got some of that from your people.
Oh, you did? So 5-HT is the precursor to some of the SSRIs like sertraline, which is Zoloft, and other antidepressants. But it's what your body uses to make it naturally. So 5-HT really helps with some of those symptoms. With the vaginal dryness, hyaluronic acid is really useful.
When I put on my face?
Yes, with a vaginal preparation. I know. Well, I mean, you think about it. It's just
For
skin.
my face and coochie?
It's just skin. It's just skin. It's just skin.
Oh, wow.
Okay, let me rewind for a minute.
Wait.
Let me rewind for a minute. Ash water.
Ashwagandha. ASHWAGANDA.
You know what I thought I had it wrong? Because I was like, look at me naming this Waganda.
That's what it almost sounds
And then the
like.
St. John's something.
St. John's
St.
wort.
John's wort, W-O-R-T.
Okay.
Yes, so hyaluronic acid comes in tablets like suppositories that you can insert vaginally, and they help with healing and repairing some of that dry tissue that tears so easily because it restores some of the collagen and elasticity. Because that lack of estrogen, really, the dryness is really just lack of elasticity. Taking collagen supplements, and finding the right collagen supplement for you too.
Because I be reading up on all that.
Collagen does?
They say collagen.
Well, I mean, it depends on the preparation. Like if it's pure collagen and like collagen extract, there are certain things like bone broths that have better collagen that you can use. But it's really, and it's so hard to figure out what's a good source because who's certifying it? Like
Right.
who says it's a good source?
Can we take all these together?
Everything that I just
So I can
said.
take St. John's wort, ashwagandha, and 5-HT all at the same time.
You're gonna be walking on cloud nine. I
Oh, I love
recommend.
that.
I recommend just starting one thing at a time because if you're going to start all of these things and you have a bad reaction,
Oh, I see. Then you won't know which one
you won't
it
know
is.
which one it is.
Anyone we should try first?
And you might not. Well, no, it's good because it's different for everybody. It's
Okay.
different for everybody. everybody. So it's just spin the wheel and pick one.
So once you try one, how long should you give it before you know that it's working?
Give it a couple of weeks. Give it
Okay.
a couple of weeks. It may not fix the problem completely in a couple of weeks, but you should feel something.
Yeah, ask your husband. He'll let you know.
Okay. He'll let you know. So for those of us who have kids, teenagers, that obviously is going to eventually get into menopause. I know, speaking for myself, my family, my mom, aunt, no one ever set me down to say, this is what you're going to do.
Ever.
Right.
Ever. So for us to stop that generational,
Right.
how do you suggest we start the conversation, and at what age should we?
So I think when puberty starts, as soon as you start talking about the beginning, start talking about the end too.
Oh.
You know, it's a good conversation for us too, especially in our community. We emphasize so much on don't be fast, don't get pregnant. don't get
Yes.
pregnant.
Oh my gosh.
And I'm having this big shift in my practice now of women who are entering their 40s saying, I spent all this time trying not to get pregnant,
Now I'm trying.
and now I'm trying and I'm having trouble. And they're like, nobody ever told me I run out of eggs.
Right.
So starting with that basic understanding of your cycle is starting now, that means you are releasing eggs. You have a certain number of eggs that you will continue to release until you run out. I don't know when you're going to run out, but it will happen one day. So just think about it. You know, just think about it.
And when you run out, that's when you are. Yeah, that's it. You are in menopause.
Anniversary day.
Yeah, that's your anniversary date.
So basically, the anniversary date is the year, the 1 year, the 1 year without the cycle.
So you basically have to mark it to
Right.
know that that is your date.
Right, right. And just like she said, oh, it was 10 months. I have patients coming in, they're like, Doc, I'm at 324 days. And then I get a portal message, came back at 300.
Wow.
You know
What's
what I
another
always thought
wrong?
was really amazing how the times that people were on their period, it varied. I always had a 3-4 day. That was it. I was off. I mean, I know people like, I'm 7, 8 days. I'm like, oh my God.
By the third day,
I was already out. It's like you couldn't tell it was starting, and then it's the 1 week every day, and then it's over. It's like, wow. I've always been
Well, you're on birth
pretty-
control, because I know that
Well,
would keep it.
even before, yeah. But even with that, I mean, I knew friends that had birth control
Yeah,
too,
they still-
but they still did a full 5, 7, 9 days.
Anything over 7 is abnormal.
Oh,
Okay.
Anything less than 3 is light, and anything over 7 is abnormal. It
Okay.
should be investigated.
3 at the 4 at the most.
What about if you've had a hysterectomy? Well, partial. I know it's not really real, whatever.
your ovaries.
So I still have something.
You know what? I love that you said that. Because let's talk about this. Hysterectomy. What does partial hysterectomy mean? So
I know it's not a real thing that you're not supposed to
It's
call it
not.
that.
You
Right.
know.
What's on the air quotes?
say I know.
I remember hearing that
I
before.
know, and we're wrong for that. So hysterectomy means removing the uterus. That's all. That's all it means. It means removing the uterus. Now the cervix is part of the uterus. So when you remove the uterus, removing the cervix means you remove the whole uterus. Okay? There's nothing else. If you leave the ovaries in, you still had a hysterectomy because the uterus is gone. What people are talking about when they say a partial hysterectomy, they think it means you still have your ovaries. That's a whole different surgery. That's oophorectomy. Removing ovaries is totally different. So when I have someone young with fibroids and
That was
young
me.
with childbearing, then
I was
we
young
say,
with childbearing. Please, I volunteer for a hysterectomy.
So if you had ovaries still, there's no way you can get pregnant. You know, some people used to get pregnant where the baby would be outside of the uterus.
Mhm.
Then what if you didn't have a uterus and then you still had your ovaries? Is a possibility to get pregnant?
Okay, girl, don't scare me now.
There has to be a way for the egg to meet the sperm.
And grow.
When we do the hysterectomy, we seal off the vaginal cuff. So there's no way for the sperm to meet the egg. We're still releasing eggs.
Right.
Where they going?
They just like the same
Okay.
place they go whenever you have periods.
But if you
just
get your
dissolve.
tubes tied, you can get pregnant.
Yes, I mean, yes. If you just have the tubes tied, it's possible. Like you can sneak one past the goal, or you could possibly like get a pregnancy in the tubes that are still dangerous.
I feel like I hear about that.
Yeah, an ectopic pregnancy. But hysterectomy, sometimes people will get a hysterectomy and they'll leave the cervix in. That's a supracervical hysterectomy. Technically, if you were going to call something a partial hysterectomy, that would be a partial. That would be it.
So am I okay with still having my ovaries? It doesn't matter? No. Okay.
Doesn't matter.
And I didn't realize I wasn't supposed to keep going to the gynecologist either. 10 years later, you know you don't have to come every year. I'm like, what?
Yes.
How did I know that?
I go every year.
Every 5 to 10, she told me.
She told me that my last visit after my gyno retired, and I went to this new person.
But you'll be going full circle soon.
Right, because I'm honestly, I've already decided that.
Yes.
But and so she just came in and she was just like, I mean, you see, you're fine, everything's fine. We don't need to see you. And I'm just like, I ain't never heard of that. We don't see me. I need to look at it.
Wait, what? That's disgusting.
Look at it. I know. I want to know that everything looking right.
So you should still have pelvic exams. You should still have pelvic exams, absolutely. You don't necessarily need the PAP, and the PAP is different than the pelvic.
Right.
So
The pelvic hurt more.
the pelvic, no, it shouldn't hurt. They're doing it wrong.
The PAP, which one with the gun?
Yes.
That's the
I'm packing it up.
Who gun, please?
Oh, shoot, I said Jack. I hate that. The clamp thing. I hate that going thing. Ugh.
You know men have a baby. Why can't they make it plastic and
I
wood?
am. I promise you, because you know what's been tires. I don't have one. I don't have one anymore. It's been a year.
So if you have a hysterectomy and you've never had an abnormal pap test, so if you have a hysterectomy and they take your cervix and you've never had an abnormal pap, you do not need pap tests anymore. As long as long as you, like, if you're, married, monogamous, no risk of contracting HPV, which is your risk factor for cervical cancer, your cervix is gone, so you never get cervical cancer.
Right.
So you don't need a PAP. Pelvic exams, though, you do still need if you still have ovaries.
They check
If you
that.
still have ovaries. Exactly.
Yeah.
That exam where we put
Oh.
money in and then press on the top.
Yes.
Feeling for ovarian masses.
Right.
Me don't like it.
I understand, Brent. I understand.
He's supposed to go in there and check that.
Exactly.
When I was 18, I had cervix displacement, and I had to go every 3 months. It was precancerous cell.
Yep.
So I had to go every 3 months until I had a normal. And what it did was they froze
Okay.
my cervix. First they burnt it, and I think they
Wow.
stopped doing that.
Go ahead, put
Then
that.
they
You know what?
froze the cervix. But then everything was fine. I was told I couldn't have a baby. I couldn't get pregnant, but I did. And I ended up fine. So all my past been fine since then. I was young. But yeah.
Can we, I'm sorry to keep going back to this, but I'm sure like myself, like most of us, we're looking for relief. The miracle cream.
Okay.
I want to go back to the miracle cream. Is that considered HRT?
It is. It is. It is also considered to have a lower cardiovascular risk because it's not a pill that you take systemically that goes through your whole system. It is absorbed transdermally. So the thought is that there is a lower, it's not no risk.
Right.
It is
Low risk.
Right.
Okay.
lower risk.
Lower risk of getting breast cancer?
Of the cancers, of the cardiovascular issues, blood clots, strokes, all
Who
that
should
stuff.
not get the cream?
Thank you. That's what I was going to ask.
Okay, so anyone who's had a previous hormone-dependent or gynecologic cancer,
Okay.
anyone who has uncontrolled high blood pressure or diabetes, anyone.
I mean, well, just tell everybody you can't drink the cream.
Good old miracle cream. Okay, what else? Anything else?
But we can control we can control that, right?
Is Popeye's going out of business?
Oh, okay.
I'm totally kidding.
Decisions
I'm
were
totally
made.
kidding. I don't even go there no more. I said yesterday. I'm kidding.
or their lungs, or any type of stroke. So
So it was an exam I had to have before he was able to prescribe.
What kind of exam?
Like my normal, like it's my normal family doctor. I mean, my
Right, so
normal
he just
doctor.
checked all your vitals.
Yeah,
and make
so
sure everything's
he
working.
knows,
Damn.
you know, everything.
and your whole history, right? Like your
Yeah.
family history. Like
Yeah,
people in
he
your
knows my
family
family.
have been on birth control or in pregnancy.
I'm
have
sorry. I just saw this shirt. That was so funny. No, it's the things to do the most.
So
Something
what about,
like that.
okay, so let me ask you this. Vitamin D
Uh-huh.
and magnesium.
Ooh, love
How
magnesium.
important is that?
So vitamin D is everything. Like everything.
Because I take vitamin D.
Yes.
I don't. I need to.
And we are all deficient in vitamin D. We
Right.
are, because our beautiful melanin blocks us from absorbing it from the sun at the same rates as our fairer skin counterparts. And so every time I check a vitamin D level on my sisters, we are low. We are low.
I know I am.
And so, but then, I check it, comes back low, and we send in that 50,000 to
Yeah.
take once a week for 8
Once a
weeks.
week.
Yeah.
And then you come back and I say, all right, last time, you were low, you want to check it again, are you still taking your vitamin D? Oh no, I finished the replacement. I'm like, so here's the thing. That was the replacement, but you need maintenance. So we should be taking it daily.
I take it daily.
And
So what's
Vitamin D?
What all should we
how
be
big
taking?
should the number be?
Okay, so the lab result, usually they'll say anything is normal from 30 to 100. We really like to see it between 50 and 70.
Okay.
Those are good numbers for cardiovascular protection. And the recommended daily allowance for the general public, it says 400 to 800 international units. That's not enough for us. We really should be taking 1,000 to 2,000 international units
Wow.
daily.
Now, is it true that vitamin D deficiency is, well, I had read about that it could contribute to
It's a
breast
risk factor
cancer
for
too?
breast cancer. Yes.
Wow.
What is
that?
Vitamin D
Girl,
deficiency.
you be reading some good stuff. Huh? Oh yeah, right. My girlfriend did too.
Vitamin D is very important.
Vitamin D
And mine
is
used to be low.
Yeah.
I
It's
got
a risk
myself
factor for
vitamin
multiple
D.
cancers, a risk factor for heart attacks, a risk factor for strokes. Like we really, our vitamin D is something that we really need to focus on because it's so easy. It's so easy.
I've been taking it every day for like 5 years.
Excellent.
I take
And watch
110,000
your
milligram once a week.
That's fine.
That's what they gave me. Once a
What
week.
about magnesium glycinate
Yeah.
supplements?
Yes.
Magnesium.
Magnesium. Yeah, I love
Magnesium glycinate.
So magnesium is great for a lot of things too. One, for insomnia.
Yes.
Yes.
I
When I
guess good
started
sleep.
taking it,
I just started now.
Yeah. That's
Really?
a perimenopausal symptom too.
Yes, of course.
It's
Yes.
insomnia. It's insomnia.
Okay.
You're not sleeping through the night. You wake up in the middle of the night, a lot of times because you have to go to the bathroom.
Yes.
That's very You get up because you have to go to the bathroom and you're like in your sleep fighting yourself. You're like, I don't want to get up because if I get up, I won't be able to go back to
Yes.
sleep.
Right.
Yeah.
But you know, as you get older, your bladder get older.
Yes. And blood pressure.
And also your pelvic floor, because estrogen receptors, that pelvic floor was keeping those muscles tight. So when you're leaking urine, when you cough and sneeze and laugh,
Yes.
that's because those sphincter muscles have gotten weak because of lack of estrogen. And so we used to be able to hold our bladders for a long time. We get up in the middle of the night and then you're not able to get back to sleep.
Yeah.
So your mind is racing,
Yeah.
you can't turn it off.
Yeah.
Magnesium is very helpful for that.
That's why I was up at 4 this morning and couldn't go back to sleep.
Mhm.
So is it okay to take it every night?
Mhm. Oh, yes.
Okay,
Yeah,
because I was,
absolutely.
I just wanted to make sure.
Yeah. Now, dose is important too. You don't want to take too much because hypermagnesemia is dangerous for your heart. So don't take large doses. We're talking about 250.
Okay.
Yeah, 250 milligrams is good.
And is magnesium the same as the magnesium glycinate or whatever?
Yes. So there are a bunch of different forms of it. The one gluconate is the one that yes. That one's fine.
Okay.
That's one.
I saw this on
Just be
something.
careful with mag citrate because that's a laxative. You
Yeah.
don't want to take that.
Right.
What vitamins or supplements should we be taking?
So calcium and vitamin D are big ones for us because again the lack of estrogen works on our bones because estrogen receptors on the bones risk for osteopenia and osteoporosis. So we should be taking the amount of vitamin D that I said before and making sure that we're getting 1,000 milligrams of calcium daily too. And lifting weights. Because lifting weights strengthens your ligaments,
Yes.
which helps to keep your bones strengthened as well.
Should we just do a
Go ahead.
Should we just do a multivitamin, or should we do all the different ones?
Multivitamin is fine.
So is gummies
It's fine.
fine?
Gummies are
What kind of
usually lower in.
Oh,
Not that kind.
No,
Not
no, no.
that. That's a talk for another day.
So anyway, go on, y'all. Never mind.
If you're taking vitamins, gummies as vitamins, just be careful of the iron content. A lot of gummies don't have iron in them.
So I don't know if I should say this, but what do you think about black girl vitamins?
I like them. I like them.
Doctor.
Shout out to Dr. Nicole.
Hey, Dr. Nicole.
Hey, Dr. Nicole.
So I do. I take them.
Everything. They have
I mean, what is it?
Oh, it's a little bit. It's a brand. Yes, it's a brand. Three black women physicians.
Oh, so it really is black girl
It really
vitamin.
is.
But you know how they do?
I know.
You think it's things like us and it's not.
Yeah. It's real.
I've seen them advertised.
I definitely went and looked it up because I was like, what is this talking about?
That part.
I was like, oh,
That part.
they are good people.
Yes, we're trying to bring this thing full circle because we're not trying to be here all night and we ain't trying to be here all night. If you had to give us any advice, of course dealing with the menopause that we're going through, what advice would you give us on how to we're stuck with it. So basically we're at the management part. Are there things we can do to make it easier, to make it better? Just give us some advice as we wrap this thing up.
Sure. So I would say to level set the people in your environment. Make sure everybody around you, like, don't add to the stigma by just having them say, she's just crazy now. I don't know why. I have a medical condition. I am and that's okay. And that's okay. And because of that, sometimes I match energies.
Yep.
You know, so
Yep.
be careful.
Sure. Well, we know anything.
And then give yourself some grace because this is a celebration. Aging is a privilege.
It is.
It means wow, you make it feel I'm happy.
Exactly. And just find out what works for you. Like hone in on what your symptoms are and figure out what works for you. Exercise in the morning, cutting out certain foods, spending more time with people who feed your spirit. What makes you happy? What exactly? If you draw enough positive energy in enough, it will push out the negative energy.
Right.
That's true.
Can you tell us how we can follow you, find you, your
Yeah.
office, how we become your patient?
Okay, we are on all the things. So we are on the Book of Faces. We are on.
That's cute.
I like that.
Me too.
We're on Instagram. We're on X. We post sometimes, you know, but really, in order to get in touch with us, Full Circle Women's Care. We're on Sharing Street in the South Side area.
She right across from Kathy.
Yes.
Oh, okay.
I have my acupuncture. What's she do?
Feet.
Yeah.
Oh,
Feet.
okay.
Feet care.
Reflexology.
Thank
Yeah.
you.
Thank you. And she does reflexology.
Honey, she does it.
She give you a massage, foot massage.
Oh, I see
Yeah,
the sign.
she does.
Yes.
She was in here the other day giving us foot massage.
She was Kathy.
You know, I told you I've been knowing Kathy from Signature House. Remember she used to work
They
there?
did now?
Yeah.
She was
Clean cuts.
Oh,
Yeah, she can, she's doing the feet
Your
though.
massage on your feet. Well, when she's done, you gonna ask for a cigarette.
Yeah.
I love it.
So So,
But
you
yes.
said, what was the name of the actual?
So Full Circle Women's Care.
Okay.
Yeah, let's all give them a follow, show them some
You
love.
said something faces.
Facebook, yes. We're on Facebook.
There it is.
But yes, so we're currently in the process of hiring more people. So if
You
you call
hiring?
now,
Booked up.
we're
Think I'm playing?
so if you call now and you're a new patient, they're going to tell you that there's a wait that will be cleared up by the end of the summer. So
Okay.
just be patient. Hold on.
Absolutely.
I'll be
So
there.
what if our request is you?
It's a long wait.
So who else works in there with you?
So the three physicians there, Dr.
Okay.
Macy Marrow, Dr. Janine Mooney, they all look like her.
Okay.
Yeah.
I was trying to figure out how to slide that in. I didn't want to.
Trying to figure out how to say it without saying it, but I
But
can't
I
without
also have
right.
my PA, Vanessa, who is Caucasian, but everyone who works there is culturally competent. They have to be, but they can't work where I am.
Right.
They have to be. And you will hear when you come there, they will call the thing the thing. I tell them, you say to them, because you are a black woman, these are the things that I am going to check. I said, don't stir around it because we are looking for people who are treating us based on our needs and our issues. So anybody you see there is going to give you that same service.
So if I'm already like, if I've had my exam for the year, then it doesn't matter to get on your waiting list because
You got time.
You're waiting
Yeah.
for me next year.
Right.
Just go ahead and sign up.
I'm all
You
caught
get
up
this
right
next
now.
year. Absolutely.
Well, we certainly appreciate you.
Yes.
I do apologize profusely about that. I am genuinely sorry about that. But we thank you for your time and your professionalism. And I must say, and I'm sure I speak for all of us here, girl, we're proud of you.
Yes.
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 Tell my daughter.
Yes.
That I meant, a Spelman night.
Yes. A black OBGYN in your office is definitely diverse. I've been there a few times. It's definitely diverse, and I can appreciate that for sure.
Thank you.
Absolutely. So yeah, we appreciate. We'll once this is, I guess you can edit this part out. Once the video is edited and all that, of course, we'll tag you or share the link with you.
Yes,
for you to look at it and do what you do with it. But yeah,
Okay.
thank you so very much.
All
Thank
right.
you, ladies.
Thank you. I don't know everyone's name.
Oh.
Go ahead.
But I'm still trying. Oh, Melanie.
Okay.
I'm Letitia. I'm Kimberly. Good to meet you.
I'm Keisha.
Hello. I know you.
Yes.
On the rock.
Yes. Oh, love it.
I'm Terrell. Hello.
I'm Keith.
And it's obvious if any of you are looking for a new OBGYN, I think it's come
Yes.
on.
Yes.
Yes. So she owns the practice. When have you ever heard of a black woman owning a practice?
Right.
Never. So proud of that. So proud of it. Yes. And for those of you out there as well watching the video, Full Circle Women's Care. Yeah, go girl. Go girl. Go girl. Hey, hey, hey. Yes, yes. Thank you. Would you like something to drink, ma'am?